Appendicular Anatomy 2. Today we're going to discuss lower limbs. Thigh, the femur, leg, tibia and fibula, and the foot. Thank you, Bob. So this is a bone you used to protect yourself back in the Stone Age. So the femur, the head of the femur always points to the midline, similar to a humerus. Also the head of the humerus points to the midline. So I know that it points to the midline, but is it left or the right? So let's look at that. So there's two important landmarks, and they also distally. So you see it comes out like that. That's medial epicondyle, similar in the humerus, medial epicondyle. So if I know that the medial epicondyle points to the midline and the head points to the midline, then this should be a right thigh, right? So it should belong to the right side. So posteriorly, very important landmark, intercondylar fossa. And that will articulate with the bone that belongs to a leg. So here's a tibia. So the femur articulates with the tibia. So posteriorly, in the femur, intercondylar fossa articulates with the tibial bone with intercondylar eminence. You see kind of two elevations. So like sitting right on top of that, like that. There are also important marks in the femur, trochanter's, like greater trochanter, lesser trochanter. So all of those elevations, they are for the muscle ligament attachments. Also in the head of the femur, you see this kind of like a notch right there. That's where the ligamentous teres will be attached. So because the head of the femur articulates with the hip bone. And here's one on the hip bone. In the hip bone, very important landmark is acetabulum. And the head of the femur will get into the acetabulum. So in this fovea capitis, that's where this ligamentous teres is attached to, will kind of be attached also somewhere within acetabular fossa, right there. And that's the articulation of the femur. So since we're on the subject of the hip bones, so I'm holding two hip bones. So which one is left, which one is right? So you pay attention to the acetabular fossa, because acetabular fossa has to point to the lateral side, because the head of the femur has to point to the medial side. So that's how they articulate. But then again, are you holding it correctly? Is it left or the right? So to make sure if it's left or right, you have to pay attention to a pubic symphysis. This is the pubic symphysis. So that's the point of articulation. And now I'm holding them correctly, right? The pubic symphysis. So this is the pubic symphysis. That's where the fibrocartilage is. So then I know that I'm holding that correctly. And now these two acetabulum, they point to the lateral sides. So another important feature in the femur, if I'm holding this correctly, there's a patella. And the patella, that's the kneecap that protects this joint, will be sitting right here. So the patella has two important parts. If you're holding this patella this way, so this part is the apex, it's in the bottom, and here's the base, right? So apex usually on the top, but in this case, well, in some other cases in the organs, so the more distal part of the patella is the apex. So the proximal part of the patella is a base. So, and this is called patellar surface. So the patella is sitting right here. So here's the tibia. So then in order to tell the differences between the left or the right tibia, so you have to pay attention to a tibial tuberosity. So the tibial tuberosity is an anterior part, and then the medial malleolus is always on the medial side. So if I'm holding a foot, and this is the foot, and I have to pay attention to where the big toe is, the hallux. So the hallux is always on the medial side. So if this is a tibia and the medial malleolus must point to the medial side, and I have to place the tibia with the medial malleolus pointing to the medial side on one of the tarsals, and the tarsal, this tarsal is called talus, and the talus articulates with a tibia, and then you see this medial malleolus wraps around the ankle. Then I know that it's a correct position, and I know that this bone belongs to the left side of the body. So in the leg, we have two bones. One is the tibia and another is the fibula. So when you hold the fibula and you want to identify if it's a left or right, you have to find first if it's a proximal or the distal part. So in the proximal part, you will have this styloid process. On the distal part, there is a malleolus. Just because leg has two bones, so tibia is always a medial bone, and the fibula is always a lateral bone. So when you hold a foot, right, and the medial malleolus wraps around on the medial side, then the lateral malleolus has to wrap around on the lateral side, this way. So it's basically kind of wraps around, you see, wraps around the ankle. If you want to be able to tell if it's a left or right, it's kind of tricky. So you see this notch, fibular notch, has to articulate with a tibial notch right here. And the styloid process kind of sticking out right here, right there, like that. So the foot. So this foot is kind of broken down, but important parts of the foot, similar to the hand. So the hand has 27 bones, 8 carpals, and the foot has 26 bones, 7 tarsals. Carpals in the wrist and tarsals in the foot, right, ankle. So there's 3 important tarsals. One is the calcaneus, your heel bone. Another is a talus. The talus supports the entire body weight because the tibia is sitting right on top of that, and on top of that is a femur, and on top of it is the entire body. So that's very important bone. That bone articulates, it's inferiorly with the calcaneus, and then also talus articulates superiorly with the tibia. And so there's 7 tarsals, and there are 3 important tarsals: the calcaneus or calcaneus, talus, and the navicular bone. It's right here. 7 tarsals and 5 metatarsals. When it comes to metatarsals, we count them from the big toe, from the hallux. 1, 2, 3, 4, 5. And then there are 14 phalanges. 2 phalanges from the big toe, from the hallux, and then each digit has 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, similar in our hand. So 7 tarsals, 5 metatarsals, and 14 phalanges, similar in the hand. The only differences between hand and the foot is just hand has 8 carpals and the foot has 7 tarsals, carpals, tarsals. So then the entire lower limb has also 30 bones. Femur, tibia, fibula makes 3, and the foot makes 26. So it's 29. The number 30 bone is the patella, and here's the patella right there. And with that, I will conclude appendicular anatomy of the upper and lower limbs.